Have you ever wondered how a simple cavity can lead to something as serious as irreversible pulpitis? Today we delve into the fascinating, albeit slightly unnerving world of dental pathology. Imagine a tooth, seemingly innocuous but suffering from a cavity. The bacteria from the decay directly and indirectly damage the pulp, triggering the body's defense mechanisms. Peptides, complement systems, and chemical mediators wage war, igniting an inflammatory response. This is the first step to irreversible pulpitis. The battle is fierce. The inflammation causes an increase in vascular permeability and hydrostatic pressure. Suddenly, the everyday throbbing pain intensifies into a pulsating, excruciating, and spontaneous discomfort, a signature of irreversible pulpitis. Prostaglandins, bradykinin, and histamine mediate this pain. As the inflammation progresses, we witness a series of complications and sequential events. In some instances, pulp necrosis, the death of pulp tissue, may be delayed. There are also cases of asymptomatic pulpitis, which can be explained by various factors. A critical factor for pulp survival is tissue hydrostatic pressure. The pulp's microcirculation, composed of arterioles, capillaries, and venules, plays a significant role. An increase in tissue pressure can lead to hypoxia and eventually necrosis. The progression of irreversible pulpitis sees inflammation and pulp necrosis becoming compartmentalized. Total necrosis can originate from the coalescence of necrotic foci. Acute inflammation may even transition into a chronic state, forming polyps and hyperplastic lesions. Typical symptoms of irreversible pulpitis can include spontaneous, excruciating, pulsating pain. A visual clinical exam might reveal cavities or extensive restorations. Pulp and periradicular tests, such as those for heat, cold, electric cavity percussion and palpation, can be conducted. Radiographic findings may show carious lesions and/or extensive restorations. Treatment for irreversible pulpitis involves the total or partial removal of the pulp tissue. Conventional endodontic treatment or conservative pulp therapy can be undertaken. In conclusion, irreversible pulpitis is a complex and serious dental condition that can cause severe pain and discomfort. The process begins with the simple exposure of the pulp to bacteria, leading to an inflammatory response that can progress to pulp necrosis. The condition may manifest as spontaneous, excruciating, pulsating pain, and treatment involves the removal of the affected pulp tissue. Always remember, prevention is better than cure. Regular dental checkups and maintaining good oral hygiene can save you from the excruciating pain of irreversible pulpitis.